Hello, my name is Angela Wells, and I am a student in the Liberty University Master's Program of Public Health with a concentration in health promotion. My practicum was completed at Self Regional Healthcare in Greenwood, South Carolina, under the direction of Cindy New, who is the Director of Wellness and Prevention. The title of my practicum was Acknowledging and Rectifying the Health Disparities and Inequities that Prevent Black and Other Minority Mothers from Receiving Effective and Adequate Prenatal and Postnatal Care. My research aims to uncover the root cause of the health inequities and inequalities in prenatal and postnatal care for Black women, implement strategies in the community to help decrease these incidents, and to save the lives of mothers and babies to decrease maternal and infant mortality rates in Greenwood and the surrounding areas. Greenwood County is seated in the lower portion of the upstate of South Carolina. It is estimated population as of 2022 U.S. Census at 69,267 people. Of this population, 64.5% are white, 31.9% are Black, and 6.9% are Hispanic. 53.1% of the Greenwood population is female, and 30% of the households in Greenwood are run by females with no male partner and has never been married. 764 women between the age of 15 and 50 gave birth. Of these births, 65.6% of them were unmarried women. These statistics provide a clear picture of the overall state of women in Greenwood County. When we narrow these statistics to Black and Hispanic women, we get a much more desperate view. Babies born with low birth weight are more likely to have health complications and spend more time in neonatal intensive care units. As of June 2022, babies born with low birth weight were at 10.5%, well over the national average of 8.2% and the state's 9.8%. Black babies were 14.9%, white babies were 7.3%, and Hispanic babies were 5.6% of these low birth weight babies. Low birth weight for Blacks more than doubled that of whites and almost tripled that of Hispanics. Infant mortality refers to babies that die before their first birthday. According to the Center for Disease Control and Prevention, the leading cause of death among infants are birth defects, preterm delivery, low birth weight, sudden infant death syndrome, injuries, and pregnancy complications. Per 1,000 babies born in Greenwood County, 6.4 die before their first birthday. Of those deaths, 13.2% are Black, 2.1% are white, and 0% of these are Hispanic. Black babies represent the highest percentage overall and more than double the national value of 5.4% and the state value of 6.5%. Maternal mortality is a growing concern in the Black community. According to Healthy People 2030, 69.9, this is out of 100,000 live births, Black women died during childbirth, almost tripling that of white women who died at a rate of 26.6% in 2021. What is the cause of fatalities? Can these deaths be prevented? Who is being held accountable? These are all of the research questions with answers that lie in the systemic issues in healthcare that have yet to be addressed and corrected. My project consisted of a cohort study done through surveys and personal interviews. The settings included the local OBGYN clinic and 3 entities that provided prenatal and postnatal care for underserved communities. Participants included Black, white, and Hispanic mothers who were currently pregnant or have been pregnant in the past 10 years. The questions on these surveys included questions for race, the current pregnancy status, age, questions asked of receiving prenatal care during pregnancy, how satisfied were you with your prenatal care, Was your provider concerned about your pregnancy? Did you feel comfortable talking with your provider and asking questions? Did you have questions that you did not ask? Why did you not ask those questions? Did you feel confident in your provider? Did you participate in prenatal classes or training? If so, why or why not? Did you receive postnatal care? How would you rate your postnatal care? Did you have postnatal concerns for you or your baby? Were these concerns addressed by your provider? What improvements do you feel can be made to postnatal care by your provider? Do you feel that race or ethnicity played a part in the way you were treated during your postnatal care? Do you feel that midwife or doula services would benefit you in pregnancy? Through this project, I was able to obtain real-time information on operations, struggles, and successes of three organizations that provided specialty care to underserved mothers. One of the entities was Afterbirth Help in Abbeville, South Carolina, which is a midwife service provided for the communities of Abbeville and the surrounding areas. Birth Matters, which is in Spartanburg, South Carolina, who are community-based doulas who provide doula services for mothers in that area age 25 and below. And South Carolina Office of Rural Health in Orangeburg, South Carolina, who provides services for underserved mothers in the Orangeburg and 5 surrounding county area. Studies show that pregnant mothers who have support of doulas and midwives have more favorable outcomes in their pregnancies. Studies also show that having doulas and midwives also helps to decrease infant and maternal mortality rates in Black mothers and babies. It is beneficial for new mothers to be able to have the emotional and physical support during their pregnancy. I was also able to interview pregnant mothers and mothers who had given birth, and they were able to share their real life concerns and experiences with structural and systemic racism, and it showed that this is still prevalent today, especially with Black mothers. I was also able to put together a summary, an outline to prepare a proposal for improvements in the prenatal and postnatal programs at Self-Regional Healthcare. Here are my recommendations. Self-Regional should add community-based doulas to their established team of community health workers. Studies show that pregnant mothers who have the support of doulas have more favorable outcomes. Studies also show that having doulas also helps to increase infant and maternal mortality in Black mothers and babies. Midwife services should also be reintroduced to the maternal care at Self-Regional. The same studies show that midwife services are beneficial to pregnant mothers as well, especially Black mothers, and also improve pregnancy outcomes and infant and maternal mortality rates. Self-Regional should also reestablish the centering program for new mothers to be able to support and encourage each other in a group setting. It's beneficial for new moms to be able to share their pregnancy experience with a group of women who are going through similar experiences. The group can also provide emotional and physical support and even provide extended avenues for resources for new moms. I also think that it's important that Self-Regional find out what the needs of the Black and minority mothers in the community are, and to strategize to be able to find out how to help these mothers and implement programs in these areas so that we can help the Black community as well as other minorities. And it's also important for us to help to stop infant mortality and maternal mortality. It can be eliminated if we all pull together and do what we need to do as a community to save mothers and babies. Finally, I would just like to say that I have truly enjoyed this project. I have enjoyed doing the research. I have enjoyed doing the interviews, and I've enjoyed going and visiting these different programs and seeing how they run and how they work and meeting a bunch of wonderful new people. And I've especially enjoyed working with my preceptor, Cindy New. And thank you, Self Regional. Thank you also, Liberty University, for giving me this opportunity. I feel like I have become a better researcher, a better interviewer, and a better person. And I am more now than ever ready to take on the challenges of working in public health. Thank you again.